Hi, I'm Rochelle Travers, and this is the Standard's Tech and Science Daily podcast. Coming up, get ready. A heatwave is heading our way. Now, let's get into it. An epilepsy device has been fitted into a British boy's skull in a world first. 13-year-old Oren has made history as the first patient in the UK to participate in a clinical trial using deep brain stimulation to treat the condition. Surgeons at Great Ormond Street Hospital mounted a rechargeable device to his skull and attached it to electrodes deep in the brain to reduce seizure activity.
They're oftentimes called deep brain stimulators, and what that's referring to is that electrodes are targeting areas deep in the brain, these essential neural networks that might provide a therapy.
That's Professor Tim Denison from the Department of Engineering Science at the University of Oxford. He's the lead engineer behind the device.
What's unique in this device is that it's relatively small and compact, as well as being rechargeable, and this allows it to go up onto the skull of the child as opposed to being planted in the chest. The advantage of that, we think, and the trial's meant to demonstrate this, is that it'll avoid some of the complications of using a device that was designed for an adult when it's tried to be applied in a young child.
This is the first UK clinical trial measuring this type of treatment for children with Lennox-Gastaut syndrome, a rare form of epilepsy. Since the procedure, Oren's daytime seizures have decreased by 80%, having a significant impact on his quality of life.
It's providing constant therapy throughout the day, but there's also additional algorithms and sensors inside the device. And the next stage of the trial is to actually unlock those so we can respond to the immediate needs of Oren or another research subject as their seizures wax and wane, and then also adjust to variants that we might see at night versus during what therapy is needed during the day.
The Children's Adaptive Deep Brain Stimulation for Epilepsy Trial Pilot, also known as the Cadet Pilot, will now recruit 3 additional patients before 22 more take part in further research.
The Cadet trial itself has 3 stages, and so right now we're in the pilot stage, and that's getting the first 4 participants enrolled, and that's what's ongoing now. There's already 2 additional stages that are funded. The next is the trial, and that will increase the number of participants up to a level that gives us statistical significance by our estimates, so we can really draw clinical conclusions. And then another funded stage is when we unlock the adaptive capabilities of the device and look to further refine the therapy based on the remaining children's needs.
The Cadet Pilot is a collaboration between GOSH, UCL Institute of Child Health, UCL, King's College London, the University of Oxford, and a UK-based company, Amber Therapeutics. Best get those fans at the ready, as yellow heat health alerts are in place for most of England this week. The UK Health Security Agency has issued the alert as daytime temperatures look set to reach 30 degrees Celsius and will remain in place for 8 regions until 5 p.m. on Thursday. A yellow warning indicates that weather conditions could pose a risk to those who are particularly vulnerable. The UK HSA says minor impacts are probable across the health and social care sector. A renowned British explorer and 2 friends are aiming to be the first to fly the Atlantic in an open-basket hydrogen balloon. Here's team member Bert Padell.
The idea is that we're going to be launching a gas balloon here in Presque Isle, Maine, with the hopes of flying into Canada, across Newfoundland, and into Europe. To do a flight like this, it requires the right weather system, and it would be foolish to take off until we have the correct weather. And so that's what we're doing now, is all of the equipment has been prepared and ready to go. And
explorer Sir David Hempelman-Adams and his crew have had to cancel the trip twice due to bad weather, but it's hoped they'll finally be able to launch in the coming weeks. Whilst on the trip, the team will conduct experiments, including a study to find out how particles from forest fires travel through the atmosphere and affect conditions such as asthma.
Basically, we just want good weather for takeoff, get across the Atlantic, and then the other obvious one is you want to land in good conditions. What you don't want to be landing is in turbulent or thunderstorms or anything like that. So there's 3 elements to it, and we've just got to get those 3 elements matching up to get across and be successful.
Their living space throughout the adventure will be the balloon basket, which measures 80 inches long and 60 inches wide. Let's go to the ads. Coming up, the 3 things that could help you live to 100 according to science. Welcome back. An investigation has revealed that nearly 19,000 NHS patients were left waiting for 3 days in A&E over a 12-month period. Channel 4's Dispatches programme has found that between April 2023 and March 2024, nearly 400,000 people were left waiting more than 24 hours across A&E departments, a 5% rise on the previous year. Their Freedom of Information request to NHS England also found that 54,000 people had to wait more than 2 days. Dispatches Undercover A&E NHS in Crisis is due to air on Channel 4 at 9 p.m. on Monday. A study by citizen scientists suggests that 3/4 of UK rivers are in poor ecological health. Thousands of people measured their local water quality between the 7th to the 10th of June and collected 1,300 datasets as part of a campaign organised by environmental charity Earthwatch Europe. The charity said 75% of tests showed the rivers tested across the UK were in poor ecological health, rising to 89% in the Thames and Anglia regions. According to the findings, Hertfordshire and Cambridgeshire had the worst water quality, with 91% and 89% of unacceptable levels of nutrient pollution. And finally, want to know the secrets to living to 100? Well, listen up. A new study from Fudan University in China suggests there are 3 things that can help you reach your centennial birthday: never smoking, currently exercising, and a highly diverse diet. The team looked at more than 1,400 people who were at least 100 years old and matched them to control participants with a similar background who didn't reach 100, but were over 80. Surprisingly, the findings showed that education, marital status, and alcohol consumption in later life made no difference to lifespan, and those who live in the city have just as much chance of hitting 100 as those who reside in the countryside. You're up to date. Come back at 4 p.m. for the Standard Podcast for all the latest news and analysis. Tech and Science Daily will be back tomorrow at 1 p.m. See you then.